questions focused on Gardnerella vaginalis, each with 5 answer choices and detailed explanations for the correct and incorrect answers. Question 1. A 30-year-old woman presents to the clinic with complaints of a grayish vaginal discharge and a strong fishy odor. She denies vaginal pain, pruritus, or dyspareunia. Pelvic examination reveals a thin, homogeneous discharge coating the vaginal walls. Wet mount microscopy of the vaginal fluid reveals epithelial cells with multiple adherent bacteria giving a stippled appearance along the edges. The pH of the vaginal discharge is 5.2. Which of the following is the most likely diagnosis? A. Bacterial vaginosis. B. Trichomoniasis. C. Candidal vulvovaginitis. D. Pelvic inflammatory disease. E. Gonorrhea. Correct answer, A. Bacterial vaginosis. Explanation. This patient presents with gray, fishy-smelling discharge, no inflammation, and clue cells on microscopy. Vaginal pH is 4.5. These features are classic for bacterial vaginosis, typically caused by Gardnerella vaginalis overgrowth and a reduction in lactobacilli. Why not the others? B. Trichomoniasis usually presents with greenish frothy discharge, vaginal irritation, and motile protozoa on wet mount. C. Candidal vulvovaginitis causes white, curd-like discharge, intense pruritus, and normal vaginal pH. D. Pelvic inflammatory disease presents with pelvic pain, fever, cervical motion tenderness, not just discharge. E. Gonorrhea may cause cervicitis with purulent discharge, but clue cells and fishy odor are not characteristic. Question 2. A 25-year-old woman presents with a malodorous vaginal discharge. Microscopy shows vaginal epithelial cells with adherent gram-variable rods. Her symptoms improve after treatment with metronidazole. Which of the following best describes the pathogenesis of this condition? A. Overgrowth of Candida species in acidic environment. B. Invasion of endometrial tissue by N. gonorrhea. C. Overgrowth of Gardnerella and anaerobes with decreased lactobacilli. D. Infection with flagellated protozoan transmitted sexually. E. Proliferation of gram-positive cocci following recent antibiotic use. C. Overgrowth of Gardnerella and anaerobes with decreased lactobacilli. Explanation. Bacterial vaginosis involves an imbalance in vaginal flora, particularly a reduction of lactobacilli, leading to overgrowth of Gardnerella vaginalis and anaerobes. This results in non-inflammatory malodorous discharge and clue cells. Why not the others? A. Candida overgrows in neutral to alkaline pH, not acidic, and causes itchy, thick discharge. B. N. gonorrhoeae causes with fever and cervical motion tenderness, not clue cells or fishy odor. D. Trichomonas vaginalis is a flagellated protozoan, causes inflammatory green discharge, and shows motile organisms on microscopy. E. Gram-positive cocci, not typical for vaginal infections. BV is due to gram-variable rods and anaerobes. Let me know if you'd like